Cancer, unfortunately, still remains one of the leading causes for deaths globally. The conventional chemotherapy, for example, has major drawbacks in that it harms normal body cells, and this may lead to harsh consequences. This has led to our research focus, where we are aiming to develop an alternative treatment methodology which uses dye molecules that can only be activated upon exposure to sound to initiate cancer cell destruction. The sound that we use in our studies is ultrasound, and it is similar to the one used for pregnancy scans or massages. Now, how exactly does this work in a clinical setting? A patient will be administered the dye molecule, which is specific to cancer, and will travel through the body without harming normal body cells and locate the cancer sites. Once it has accumulated at the cancer sites, the dyes will be exposed to the sound, which will then initiate harmful effects and eradicate the cancer cells. The mechanism in which the dyes become activated by the sound is shown on the slide, where an ultrasound in its physical form is a wave that will cause the formation of bubbles in the cell. The forming bubbles will also burst to emit light. The energy from this light can thereafter be absorbed by the nearby dye molecules within the cell. These dye molecules thereafter become activated and will transfer this energy to nearby molecular oxygen in the cells as well. The oxygen will then become activated and will become highly reactive. The oxygen in this form is highly dangerous to the cell and will lead to the destruction of the cancer cells. We've tested this method in the lab using 2 cell types, and that was the breast and the cervical cancer cell types. Our results have shown that the ultrasound alone and the dye molecules alone do not harm the cells, but in combination, they do initiate cell destruction. In conclusion, we've confirmed that this method could be a promising alternative to the conventional treatment methodologies, and it offers a technique that is non-invasive and is controllable. That sure does sound good. We've dedicated this work to all individuals that are affected by cancer or cancer of a loved one. Thank you.